all 28 services in the Dublin North region. The purpose of the Nursing and Midwifery project is twofold. Firstly, to develop the research role, profile, skills and experience and research output of clinical nursing staff in Dublin North. And secondly, to set up collaborative research networks of nurses and midwifery specialists, clinicians and academics in relevant disciplines.
So if we can't measure care, we can't improve it. We need some system within our services for measuring care.
So the evaluation, we wanted to look to evaluate if the nursing and midwifery metric system provided an appropriate reporting mechanism for the quality and standard of care being delivered at ward and unit level at a point in time.
So therefore I do think in terms of the future of our health service, there's a really serious discussion to be had among and between nurses, nursing leaders, our professional bodies and society. We need to produce the evidence, therefore you need to be willing to work with us to produce it, you need to work with us to help the data collection, help design the studies, come up with the studies you know you need to make your practice better, because we need to get that evidence out there. It needs to form part of every single discussion that's going on, from the sort of manpower planning, hospital discussion, through to the corporate hospital group board, right into the department. We need this evidence. We need to engage the public in a serious discussion about what is potentially getting lost, what potentially we can do about it, and indeed what it potentially is going to cost.
So it's more important than ever that we get off the treadmill that we are on. We're lashing around the place, and we stop and think about how we cared for those people before they died, so we can learn from lessons and we don't make the same mistakes again and again.
I can't skip an opportunity to mention the importance of education in nursing, but maybe to talk about education as being a combination of both knowledge and practice. Both of them stem from and in turn are driven by research. And today I think will be a demonstration of that combination of how practice and knowledge come together in order to generate research that again regenerates that notion of new knowledge and new practice.
We know that they're doing a very, very good job. But again, like a lot of, talking to a lot of my colleagues in practice development, you don't always see that. It's not reflected in our nursing records.
So as nurses and midwives working on the front line of service delivery, you have direct access to patients and service users and the clinical environment. So REACH will support you to enable and facilitate patient and service user involvement in research to influence patient benefit and improve outcomes.
I wanted to explore the experience of informal carers and ultimately then to make recommendations for practice.
I believe that we need to improve the definition and measurement of complex intervention outcomes. I think we need to use research evidence systematically to develop interventions. So I stress again the importance of the theoretical and of the modelling phase of the medical research council guidance. And I think we have to adopt relevant research design. And that research design should be dictated by the research question, and the research question should be developed in relation to knowledge gaps that are available in the literature. I think there are some issues with a randomised controlled trial in nursing research. I do believe it is still the gold standard of experimental research design, but I hope during this short presentation I've highlighted the potential role that qualitative research can play and the benefit of qualitative and quantitative research being together to provide the best outcomes.
I thought this is very important. Albert Einstein said that if you can't explain it simply, then you don't understand it well enough. So I hope by the end of this presentation you'll all have a good understanding of treatment modalities and definitely the signs and symptoms associated with this arrhythmia.
I think basically we've known really since the time of Mary Bridgman and Florence Nightingale and Catherine Macaulay and Mary Aikenhead that nursing is very important in terms of monitoring patient progress and in terms of providing safe, good quality nursing care. And I think these women would have also been very forthcoming, shall we say, on the importance of underlining the provision of a humane care experience. I think it is important, however, to recognise that it is now necessary, absolutely necessary, to build the evidence base to support that knowledge, if you like, to support those assumptions. And I guess that's what we're in the middle of trying to do at the moment.
Research. What is the right thing to do? And research always seeks new knowledge. When we think about research, there are different methodologies. We talk about qualitative, quantitative, phenomenology, quantity theory, many more.
I mean, the quality of presentations, the diverse range of presentations that are here today is an indication that it's pushing an open door.